Hello, I'm Todd Robbins, owner of Robbins Rehabilitation. And if you're receiving this video, that means you've had your first appointment at Robbins Rehabilitation. You've had your initial evaluation, had some treatment, and probably been given a little bit of homework to do. So this is a video that I want to get some information across to you with about what to expect after your first treatment. It's likely we discussed this in the past, but we just want to reinforce this. After your first treatment at physical therapy, it's not uncommon to have some soreness or some aches and pains or feel like you did something a little bit different. This is important to know because some patients get nervous after the first appointment. So, well, we tried some stuff and, hey, I'm a little bit sore or maybe I'm feeling some more pain. Oftentimes patients feel less pain after the first treatment, but sometimes we do different things that are trying to stimulate the tissue and get you moving a little bit more. You may be in pain. That is normal and typical. Some patients may feel like, well, I don't know, should I come back for my next one if I'm in pain? Absolutely. If you are in pain or problems, the physical therapist's office is the best place for you to be. But you can expect that. Don't be alarmed. But you want to talk about that with your physical therapist and describe the symptoms that you're having, describe when you have them, so that we can adjust treatment and get you going in the right direction. When you had your first treatment, you also had your insurance benefits explained to you. This is such an important part of physical therapy and something that causes a lot of confusion. Insurance companies are purposefully confusing and they want to make it difficult for you to understand your benefits. That's why we try so hard to explain them to you. But there may be questions. If at any point you have more questions about your insurance coverage or what you're responsible for, we want to answer them for you up front. We are very, very forward about that, and it's something that's so very important to me because I've had bad situations in the past where I just got sent a bill and there was no explanation of what the bill would be or what it was for, it was very disheartening, and I never returned to that place. So I never want to have that experience. I want you to know exactly what you owe through your insurance company and what the guidelines are. A lot of our patients have high deductibles, high co-insurances, high co-payments. So we want to work with you. We understand that it's expensive and it can be to come to physical therapy. If you need to set up a payment plan or work out different options, talk to your physical therapist, okay? They can help you and help make decisions on what's gonna be best for you as far as your treatment and how to make it affordable. And we are very comfortable spreading out payment so that you can get the care that you need, get better, and also fulfill your obligation of payment. That's something that's so very important for us, but we wanna get you better. If we have to spread out those payments, we can certainly do that. You've likely gotten some home exercises and homework to work on, depending on what happened the first day of treatment. Your home exercise program is really, really important. We spend a few hours a week with you here in the clinic, and you have the rest of the time all week long to help get yourself better faster. Our patients that are diligent with coming to their appointments and doing their homework at home get better faster. That's why we give them to you. It's important that you're an active participant in this outside of our offices. You've probably been told about our cancellation policy. So we just ask for 24-hour notice before your appointment if you need to change it or move it. We're usually pretty flexible. You can, if you need to change that earlier or later in the day or move it to the next day, please contact us. If you don't come to your appointment and you don't give us 24 hours advance notice, then there's a $30 cancellation fee associated with that. That's because we've reserved time for you with a physical therapist and have our resources here to treat you. So we need to kind of hold people accountable and make sure they're coming in for our appointments. Well over 90% of our patients come to all of their appointments, so we have a very good arrival rate, but we do have that cancellation fee in place. Just so you know, we take that money and donate it to the charity that we're supporting at the time, so we don't keep the money. The important thing for me is that you're coming into your appointments. That's very, very valuable to me. I don't want your $30 because you didn't come in. It does go to a great cause, but I want you coming into your appointments. Another important thing when you're scheduling, you've likely scheduled out some of your appointments, and it's just important that you know that we typically work on treatment teams in our offices. Because we cover 13, 14 hours a day, some therapists are here in the morning, some are here in the evening, so depending on your schedule, you may see a different physical therapist. We try and limit it to 2. So we work kind of on 2-person treatment teams that cover different hours. You may see a different physical therapist, and what I always say is it's very good to have someone else kind of take a look at you, get an assessment of what's going on, but we want to get your care to be consistent. So we typically stay on teams. We meet weekly to talk about our patients, and then we're together in the office all the time to discuss what's going on with you. So you may have different therapists working with you, which I think is a benefit. You get more eyes on you, and more things that you can do to get better. But you can kind of expect that. If you do want to stay with the same therapist, you just have to fit into their schedule. So it depends on what days and times that they have, but talk to the person who is scheduling you. And if you want to be on a certain schedule, just let that person know, and we'll keep you on that schedule. Finally, I want to let you know what our goal is for you for physical therapy. It's a successful discharge, okay? We're getting you from the problem that you have now and hopefully to 100% better. So the way that you felt before you ever had this injury. That is our goal. More than 80% of our patients reach this goal and get there. And we're very, very proud of that. But like, it's important that you understand how, like, that is going to take some time and some effort on your part. On average, our patients are here for somewhere around 12 to 14 visits. Depends on the condition. Some are shorter, some are longer. Usually that takes about 4 to 6 weeks, depending on how frequently that you're coming in. So unfortunately, this is not an overnight fix. I tell all my patients, I wish I had a magic wand. We could all come in the morning, I can wave it, and we can all go home. But that's not what physical therapy is. There's a time investment and there's an effort investment, but we're going to give you all the tools that you need to get better. And I'm confident you're going to be able to do it. But that's our goal. That's where we want to get you. If you're getting anything misunderstood or not understanding where you are in this process, we want to show you where you are. Talk to your therapist, and we're also going to be sending you more videos along the way to make sure that you're on track. The number one most important thing for me is that you get better, that we have a success with you, and you leave physical therapy, as close to 100% as possible, and understanding what you need to do to keep it that way. That is what we do here at Robbins Rehabilitation. So it's important that you understand that, so that we are all on the same page in getting you to that point. If you have any issues or problems, talk to your therapist, and if you want to contact me, please feel free to contact me. You can email me, todd@robbinspt.com, or call our offices, and if there's anything that's stopping you from getting to 100% that I can help you out with, I will personally help you out with that. It's very, very important to me. Thank you for choosing Robbins Rehabilitation. I really appreciate you investing in us and trusting us to help get you better, and that is exactly what we are going to work on doing.
My job is very